Welcome to the Eurobodalla Health Service webinar. Thank you to the 27 people that have joined us online at this point in time. Thank you for your company and we look forward to having the evening with you. My name is Renata Sheehan and along with my colleague Rebecca Bergman and Vanessa Barrett, we will be facilitating this session. On behalf of all of us here, I would like to start by acknowledging the traditional owners on the lands of which we variously base this evening, meet and pay our respects to elders past, present and emerging. Tonight we have a fabulous panel. I'm very pleased to introduce to you Margaret Bennett, our Chief Executive of Southern New South Wales Local Health District, Megan Connors, the General Manager of the Coastal Network, Southern New South Wales Local Health District, and Matt Malone, the Senior Project Director of Health Infrastructure. Before we get on with this evening's proceedings, just a little bit of housekeeping. As I mentioned, now we have 32 people online, which is great. Thank you and welcome. And all participants are on mute. You'll see at the bottom of your screen, there is a Q&A function. You can submit your questions there. And as the evening goes on, your questions will be put to the panelists throughout and of course at the end of the sessions, time permitting. The sessions are being recorded. Videos of the sessions will be available on our project website by early next week. To get our proceedings underway, I will now hand over to Margaret, Chief Executive of Southern New South Wales Local Health District. Thanks, Margaret.
Thanks so much, Renata, and good evening, everyone. Thank you so much for taking the time to join us tonight. It was great. I think we had 63 people online last night and another great group tonight, so we're very grateful. We really do appreciate your interest, and of course, this is all about your passionate advocacy on behalf of your community. As you're all aware, we'd hoped to meet you all face to face, but given the challenging COVID environment, and how it's continuing to evolve, we needed to make the change to this virtual session. We're very much looking forward to having face-to-face sessions as soon as it's appropriate and safe to do so. It may be that we'll need to have another round of sessions like this before Christmas, but we'll just see how things go with COVID. I'm very grateful for the more than 40 questions we've received in the lead up to last night's session and tonight. And as I hope you'll hear, we've used your questions to frame our comments and response tonight in the hope that you'll finish tonight's session with confidence that your questions have been answered and that we're really trying very hard and very committed to meeting your information needs. As Renata said, anything we don't get through tonight or all the questions tonight and anything we don't get to will form part of the frequently asked questions update that will go on the website next week. I'd like to welcome our board chair, Dr. Alan Hawke AC, and the board members that are joining us tonight, and also a great welcome to Brad Rossiter, OAM, and the Community Advisory Council members that are online tonight. On the panel, as you've heard, we've got Megan, our General Manager, and Matt Malone. We're also joined by Catherine Lyons, who's our recently appointed fabulous Site Manager, Director of Nursing for the Eurobodalla. And so in getting underway, I'd like to cross to Megan for a minute so that she introduces herself, and you'll be hearing more from her later, and then we'll go to Matt. Thanks, Megan.
Thanks, Marg. Hi, everyone, and thank you for joining us tonight, as Marg has said, to hear about what's happening for the new hospital. For those of you I've not yet met or am looking forward to meeting, I am Megan Connors, the Coastal Network General Manager. I've moved to the coast in April this year, and my husband will be joining me in the next few weeks, which I am really looking forward to. I'm absolutely delighted to be here and look forward to living in and working with the community and being part of the journey that we have ahead. Thanks, Marg.
Terrific. Get across to you, Matt.
Thanks very much, Marg. Hello, everyone. My name's Matt Malone. I'm the Senior Project Director with New South Wales Health Infrastructure for this wonderful project. It's a delight to be with you here tonight to share an update on the project. And I've been fortunate enough to be involved in this project now for a little over a year. A quick personal note about myself is that whilst I'm not a local to the Eurobodalla, I live in the Milton-Ulladulla region and spend a fair bit of time, mainly at weekends, down in the Eurobodalla, ferrying kids to sport and going to events. Thanks, Margaret.
Thanks, Matt. So, ladies and gentlemen, the aim for tonight was to introduce a team, so we've started with that, and to answer as many of your questions as possible, and by doing so, give you a good sense of the plans for the Eurobodalla Health Service as a whole, and also give an update on the new hospital planning, where things are at. But before we get underway with those elements of tonight, I just want to give a quick COVID update. There really wouldn't be any community forum with health at the moment that didn't give an update with regard to COVID. And I'll make a few summary comments, particularly because there were some COVID-related questions that came through to us prior to this. And it's stating the obvious, but the pandemic has certainly created an incredibly challenging time for us all, and we still have quite a journey ahead of us. It's anticipated that the next 4 months will be particularly challenging in New South Wales. Look, our Southern website has got all the up-to-date info you might be needing about testing and vaccination and new cases and sewerage testing and venues of concern. It also provides you with the link and opportunity to ask any questions and seek clarification. And I just say, don't ever hesitate to use that. Our overall focus in Southern continues to be on testing and vaccination, and also on our agility and our readiness to respond. This is a challenging, evolving pandemic, and it's impacting on us all in different ways. As you'd expect and imagine, our staff are doing a most remarkable job in going above and beyond to keep the community safe. Our public health staff, for example, are supporting the intense contact tracing that's underway, and not only in Southern, but they're also supporting the endeavour in the 6 key LGAs of major concern. We currently have 6 COVID cases in Southern, 3 in Goulburn, 2 in Queanbeyan, and 1 that was announced the day before yesterday in Googong. The detection of COVID fragments in the sewage at several sites across the district, Merimbula and Cooma, and most recently Thredbo, where we don't have confirmed cases, is of great concern to us. And that's why we continue to stress and request the community to get tested if they have even the mildest symptoms. Our facilities are on red alert and fully prepared for COVID presentations. I won't repeat what's on our website, but we're offering a range of vaccination options, including new AstraZeneca walk-in clinics, and this option will be available at the Batemans Bay Soldiers Club between the 9th and 11th of September. And I'd be really grateful to the community participants online if you were to stress this in your with your neighbourhood and contacts. We've had several walk-in clinics for Aboriginal community members at Bega, Goulburn and Queanbeyan in recent weeks, and I'm really pleased to note that they've been well attended. So just finishing off here, most COVID patients are managed virtually in the community. Extraordinary today to hear in the state meeting that, for example, the Sydney Kids Network have got 1,200 positive COVID kids being managed on virtual care, on home monitoring. And as I reflected to the group last night, it makes you wonder how we would be coping with the enormity of this pandemic if we didn't have the benefit of technology that didn't exist a few years ago. So we're currently managing COVID patients in their home, and certainly had a lot of experience of this last year with the previous outbreak. And part of this is monitoring their oxygen levels remotely and checking in regularly and having escalation pathways if there's any deterioration at home that brings them into hospital. So then specifically in terms of the Eurobodalla, both Batemans Bay and Moruya hospitals are ready for COVID patients with active screening and response plans in place. Both hospitals have isolation areas ready for suspected cases and have transfer pathways in place for very sick patients who require more specialised intensive care. So that I'll just leave that there, but if that makes you think of more questions, please let us know and we'll be happy to respond. So moving back to the Eurobodalla Health Service more broadly, many of the 40 plus questions we received had some similar themes, and really we saw them fitting into sort of 4 main groupings. There were questions from you seeking clarity regarding what is intended and questions around language, questions around workforce attraction. Not surprisingly, the biggest group of questions received was regarding clinical service delivery. And also not surprisingly, there were some key questions around the actual building of the new hospital and timeframes. So I'll start by addressing the questions around clarity of intent and workforce, and then Megan will answer the service delivery questions, and Matt will then follow up with an update on the hospital project planning specifically. As Renata said, look, I encourage you to please submit any additional questions as we go through tonight, and we'll get to them if we possibly can. So in terms of clarity of intent, some of the questions included, now it's a Georgie Rowley question about, will the new hospital be regional? There was questions from Deborah Stevenson around why is the Eurobodalla Hospital now being referred to as the Eurobodalla Health Service? Are we getting a new hospital? And if so, will it offer all the clinical and core services of a level 4 when it opens? And there was a few questions around what's a Health 1 and what does it mean? So I'll start off with those. When we talk about the Eurobodalla Health Service, we're referring to much more than just the new hospital. And this is an important context for explaining service delivery, which Megan will go into in more detail shortly. The Eurobodalla Health Service includes our community health centres. It encompasses non-admitted patient services such as virtual care, care in the home, palliative care, and importantly incorporates the care we deliver in partnership with other agencies, for example, the Primary Health Network Coordinator, the GPs and Katungal. So I guess to sort of put it in a cascade, Eurobodalla Hospital is a key component of the overall Eurobodalla Health Service, which in fact is then a key component of the Coastal Network, which is a key component of Southern Health. So the new hospital will most certainly be a regional hospital. Right now, we're taking the necessary steps to grow level 4 capability, which will evolve over time. That includes the work we're doing right now to enhance emergency care and the close observation care at the Mariga Hospital, and a necessary step in enhancing capacity and capability to look after higher acuity patients. I think it's important to state that no new hospital opens with everything that's fully evolved on day one. And certainly speaking from experience, and I guess from the privilege of having taken on board new hospitals in 2 states, 3 new hospitals over my long career, I can speak with some experience about how you've got to stage the development so that you get things safe and then you build to the next level. And I guess in our own district, we've got a couple of good examples in terms of Southeast Regional and Goulburn, where we are continuing to expand service delivery and service complexity. The important thing is to build a hospital that has the capacity and the network arrangements to safely meet the service level required and expand over time. Some services will operate at level 3 at completion, but we're working towards increasing capacity to level 4, and Megan will speak more about that in just a minute. So there was a question from Michael Holland, Dr. Holland, and he asked, following the recent announcement of the Health 1 facility for Batemans Bay, will Southern provide a Health 1 facility for the population of Narooma? Look, thanks, Michael. Not currently planned. Given that Narooma has a community health centre at the moment, the district's immediate focus was on the establishment of a centre at Batemans Bay. Given that the new Eurobodalla Hospital will result in the closure of the current facility at Batemans Bay. And so it was very important that we were able to attract the support and the funding to develop a Health 1 at Batemans Bay as part of the development of the Eurobodalla Coast services, and our gratitude for Minister Constance's recent announcement. So the next port in all of that is going to need to be quite a lot of community consultation, which I'm really excited about, to actually consider how we can optimise what a Health 1 facility at Batemans Bay will mean for that community. But think that, that there's a broader intention behind Michael's question, which I appreciate. And I think that is really about the importance of us growing community and primary health services as part of a robust network. Certainly it's exciting to be building a wonderful new hospital, but it's equally critical that we are investing in and developing community health services across the coast. Moving on to workforce, there was a great question from Fitzroy and Marlene Bolting, and it was, what incentives are in place to make the prospect of working in the new hospital attractive? And I reflected that's a critical, important question. It's all very well to be talking about beautiful infrastructure, and we're all excited about that, but unless we have the staff to provide the services, we're not getting anywhere. So certainly a beautiful, new, well-marketed and well-managed facility is an attraction in itself, particularly when it's part of a dynamic network with well-established broader partnerships. But there are a few specific things I would speak to that will assist in addressing the question that Fitzroy and Marlene have asked. We're already working with our university partners to strengthen undergraduate and postgraduate education, and actually making sure there is an on-site presence to support this at the new Eurobodalla hospital. We're also working with universities and with 2 other neighbouring health services with regard to developing research capability in Southern. And that's a key consideration in growing our workforce. Attracting young professionals is all about making sure that we've got career development opportunities and that they don't have a sense that they're missing out on anything by moving to a regional centre. We know that, of course, supported professional networks attract specialists, and a range of actions in that regard. We're currently recruiting to a Director of Medical Services to head up service delivery across the coastal network. We, 12 months ago now, established 12 new medical leads across the district to help build a collegial environment with strong leadership and clinical excellence focus. And we're also investing in additional medical leadership on the Eurobodalla. Look, there's lots more to do in that regard. We're working with the Clinical Excellence Commission, who are guiding priorities in terms of service development, and have recently assisted us in establishing the priorities to grow the high dependency, the close observation unit, and moving towards intensive care status. We've just commissioned a medical workforce plan for the whole of Southern, but with a particular component around medical workforce development on the coast. So that gives you a bit of a sense of some of the things that we're doing in that regard, but it'll take every bit of the next 4 years to make sure that we're doing everything we can to attract, recruit and retain staff for the new facility. I think another thing that's been mentioned, and certainly something we haven't got nailed at this point, but we need to work on this, we need to look at the issue of staff accommodation, and are exploring on-site accommodation opportunities, and what we'll need to do and establish in the couple of years ahead, so that we are able to support staff who need accommodation. So I'll stop there for a minute and hand to you, Megan, to do the next bit, please.
Thank you, Marg. Hi, everyone, again. So as Marg mentioned at the beginning of her talk, the majority of the questions we've received so far have been about clinical service delivery. Questions have mostly been focused around our maternity, paediatrics, orthopaedics, intensive care and emergency services in the new hospital, as well as the purpose and operation of the new coastal network. So we've had some questions from Mylene and Fitzroy Bolting that have asked around the coastal network. So how does the network operate? Does this mean that resources are going to be directed mainly to Bega, and Eurobodalla patients will continue to travel to Bega for relevant specialist treatment and major surgery? So I'd like to begin by explaining how the network is coming together and what the network brings. So it brings together a range of healthcare services and diverse populations across the South Coast region, extending from the Eurobodalla down through the Bega Valley. The network's health services have and continue to be designed to address the health needs of its residents and the thousands of tourists that are lucky enough to visit here each year. The coastal network brings together real similar communities with really similar health needs, whilst recognising the unique identity of each of the communities as they hold them. The health services being provided and planned are designed not to compete, but rather complement and support greater access to a wider range of services right across the region. Being a part of a network also allows our workforce to grow, connect, learn and develop new ways of working and providing care to our people. The coastal network hospitals are supported by community health services and partners across the region, as Marg has described, and they provide a range of services from emergency care through to rehabilitation, oncology and renal medicine. The network also allows us to stay very connected with our various partners, such as Katungal and Coordinator, as Marg rightfully pointed out, so that people have really well coordinated and connected care to ensure they stay well and our communities thrive. One of our other really big partnerships and along the coast, and particularly in the Eurobodalla, I'm starting to work very closely with Ambulance New South Wales in terms of our capacity to work together for pathways to care for people at end of life or with chronic disease to try and help them stay at home as safely and as far as we can. We're striving for better patient outcomes and for our community to receive the best care. Wherever possible, we aim to provide that care as close to home as safely possible, and sometimes that best specialist care is further away in places like Nowra, Canberra and Sydney. The new facility will be a major regional hospital in the coastal network, and in its very own right, the hospital stands at the doorway to our external networks with Canberra, Illawarra, Shoalhaven and Sydney. Our teams have already started some really wonderful work, which I'm quite proud of in the 5 months I've been here in the coast, in developing new models of care that will support transition to the new facility. Our models of care broadly define the way that our health services are coordinated and delivered. It outlines the practices of care and the services for a person, a population group or a patient cohort as they progress through their stages of an illness, a condition, injury or significant event. As Marg has mentioned around COVID-19, it has been and continues to be our greatest teacher. It has allowed us to better understand the multiple ways that we can provide care to patients in their home when it is safe for us to do so, or when they're at their most vulnerable in a hospital environment. Through technology, we are able to connect with specialist clinicians in tertiary referral centres to support our staff when and where they need that. So several people have asked a lot of questions about mental health services in the new building. And in response to that, whilst the new hospital will not have a dedicated mental health unit, it will include inpatient beds for admission of people that are experiencing a decline in their mental health. And most of the care for our patients with, or our people in the community with acute behavioural disturbance or a dependency, and they require specialist care, the best place for that to be served is in a community setting. And we work very closely with the mental health, alcohol and other drug team and their strategy across the district. We're introducing a new tele-stroke service, which is very exciting for the region and certainly for the local health district, that will provide really strong networked virtual support and specialised medical guidance to implement world-class immediate care for patients with suspected stroke, regardless of their location. Some of our models of care work will really determine how we provide stroke care in the Eurobodalla and the wider region by introducing stroke-ready beds and building a workforce to support its delivery. Virtual models of care are emerging so very quickly. I'm sure you've all experienced the changes in technology, and we are progressing the delivery of in-home monitoring for people living with chronic disease or do not require admission to hospital but just need some support. Our virtual in-home monitoring service will also enable us to rapidly respond to COVID-positive people, as Marg's described, that can be safely cared for at home or in a dedicated accommodation environment such as quarantine hotels. As Marg said, we've received several questions about the level of clinical services that we will provide when the new hospital opens. In some feedback, I've received reflection that resonated quite deeply from me from one of our really senior, well-respected clinicians. And what they said was, it's not about the size of a hospital, but it's about the services the hospital will deliver. It's also important that we understand that the hospital is not built to a level, it's the clinical services within it that are described by a level. The new hospital will include clinical services at a level 4. Some of these services, Marg said earlier, will operate at a level 3 at completion of the building and will work very quickly towards increasing capacity of those services to a level 4 as safely as we can. The level of a clinical service is used really to describe the minimum support services that are required to provide that care. So that includes the workforce, the support services, things like medical imaging and other requirements for the safe delivery of the service. So that also includes our relationship and partnerships with the networks that we've described with Canberra, Illawarra, Shoalhaven, Sydney and Bega are really important to our ability to grow our services as we move into the new hospital. Each clinical service is being planned and developed to the level appropriate to meet the needs of the catchment population, ensuring it works as efficiently within the health system as a whole, as well as improves local access to healthcare. The journey in strengthening and expanding our models of care for the Eurobodalla region has already begun. We currently have interim works underway at Moruya Hospital to ensure that the hospital continues to meet demand during the planning and construction of our new hospital. Fitzroy and Mylene Bolting have asked us when the upgraded ED is going to open. So in response to that question, the Moruya ED expansion is just shy. So the ED expansion and the COU, or the Close Observation Unit combined, is about a $2 million project that the ED is planned to be completed later in the year. The expansion will see the provision of 2 new resuscitation beds in its own new zone, a central clinical hub for our clinicians to be based so they've got full line of sight to their patients, and 4 new treatment bays for low to medium levels of care. There will be an overall increase in 5 treatment spaces at the Moruya Hospital, and existing clinical areas will also be refurbished to improve storage and access to the resources our staff need to keep our people safe. A question from Deborah Stevenson was around, there are a number of core services not currently offered by Moruya and Batemans Bay hospitals, which are considered a minimum to support various level 4 clinical services. In particular, a close observation unit as part of an intensive care service, which is critical in a remote area such as the Eurobodalla. Will they be part of the new hospital? It's a great question, Deborah, so thank you for asking. The refurbishment of the close observation unit is progressing very well. The unit itself will include 7 monitored treatment spaces and will be completed, we were hoping, at the end of September, and that will be dependent on COVID restrictions and our ability to have specialist teams on site to complete some of the technical work. The close observation unit is an absolutely integral step for us to achieve a level 4 intensive care unit at the new hospital. We've really skilled and capable staff to provide close observation unit care right now. Recruitment to nursing and medical positions, as Marg has referred to earlier, is planned and needs to be balanced with the timing of service levels and models of care changes as we move into the new hospital. It's very important that we understand that we cannot open an ICU in the current hospital safely. What we can safely and reliably manage, and I think some of you may have experienced or heard stories about the wonderful work our clinicians do provide, we can really safely and reliably manage critically unwell people for a short period prior to their transfer to a higher level of care. We're working in partnership with the Agency of Clinical Innovation and Intensive Care New South Wales. These are pillars of New South Wales Health, to take the necessary steps to get as close as we can to an ICU level prior to moving in, with the intention of accelerating that transition to an intensive care level following day 1 in the new hospital. It's important how we prioritise those models of care and the services we deliver to get the foundations established before we introduce things we haven't done for a while, or maybe even before. We've had a question from Heather Cox. Thank you, Heather. She's asking, could I please tell the meeting how many maternity beds will be provided? Is there more or less than what we presently have at Moruya? And Mylene and Fitzroy, Bolting have asked, will the new hospital also provide level 4 paediatric services? So I'd like to reassure you all that the new hospital will open with a co-located paediatric and maternity service. The maternity services will gradually increase from their current level 3 to a level 4, and neonatal services from a level 2 to a level 3 service. We are really excited about the reintroduction of paediatric services to the Eurobodalla and strengthening our partnerships with both Canberra and Illawarra, Shoalhaven, to support our kids when they're unwell. Contemporary hospital design and models of care enable us also to support the integration of clinical services. So with the senior medical leads such as Dr. Michael Holland and Dr. Susie Piper, we can bring together maternity and paediatric services in our wards and units that sit alongside each other. This will see improvements in the health outcomes of our women and children as co-located services create a single point of people to have contact with healthcare providers. The hospital design has been clinician-led, and the models of care workshops will continue with this input to further detail practical ways of working for our staff. Work to design the clinical workforce and specialist recruitment strategies will be developed in greater detail as our models of care are determined in line with the service levels that we will work with. As we get closer to preparing our move into the new hospital, we aim to start recruitment and build reliable networks with other services to support connections with care and stabilisation of our teams. Several people have asked about bed numbers and whether the hospital has been designed in line with the demands created by the future Eurobodalla population and tourist seasons. In response to that, the new hospital is a much larger facility than currently exists between the combined Bateman's Bay and Maria campuses for our staff and patients to receive and deliver their care in. There will be no loss of beds in the region when the new hospital is built, and the new working environment is going to transform the way we experience healthcare and also provide it. A simple example of some of the changes that you will experience as community members, and certainly for our staff, they're a bit excited about this, is that our patient rooms will have en suites adjoining to them, where we currently have shared bathrooms that require our staff to wheel people to a bathroom, so for a shower and so on. So that's they're very excited about that. The way we work will also change, with inpatient units configured in a way that allows us to support what we call a flex up down arrangement in all of our clinical areas. So as the demand increases for a particular service, we'll be able to swing across into beds in other units to enable those units to have more beds available at any given time. Southern New South Wales Health and the Coastal Network is aligned to the concept of one team that shares and combines services for the greater good and a greater number of its people. Before I'm just going to hand over to Matt and look forward to some questions in a little while. Thanks, Matt.
Thank you very much for that, Megan. As I mentioned earlier, I'm delighted to be here this evening to share with you all a project update. I'll take the opportunity firstly to acknowledge some of the other team members that are on the call tonight, including Catherine Taylor, the Director for Rural and Regional of New South Wales Health Infrastructure, Orestes Lomas, the Eurobodalla Health Service Project Director, Tracy Bates, the Southern New South Wales Local Health District Project Lead, and Jim Herford, the Southern New South Wales Local Health District Change Manager. As mentioned, my lot tonight is to provide an update on the development of the project and some of the achievements that we've come across to date on the project, including some of the upcoming activities that we're looking forward to commencing. Wonderful slide on the screen there just shows you one of the great milestones that we've come across so far, which is selecting the preferred site for the new hospital. You can see the location on your left there, and one of the sites of one of the photos of that site on the right-hand side of the screen. It's important to acknowledge that the project team is planning a hospital that includes services such as an emergency department, surgical and operating theatres, day-stay surgical unit, a paediatric and maternity service, an ambulatory care clinic, chemotherapy and dialysis services, and education facilities. This isn't an exhaustive list of everything that's going to be included in the new hospital. They're the key items, the takeaways. There's everything else that needs to go with that hospital as well, including the back of house areas, the loading docks, access to car parking, and future growth as well. A few points that have been touched on already, but I would take the opportunity here just to highlight these as well, that the new hospital that we are planning for is being planned to be larger than the combined existing Maria and Bateman's Bay hospitals combined. And the hospital is also being designed to enable future growth as the new site will continue to grow over future decades. And we'll talk about this in a little bit more detail further on when we talk about some of the master planning work that we have achieved or completed so far on the project. So this project will move through various stages from the inception of the project through to operational commissioning and normal service. The project's currently working through the planning phase activities. As I mentioned earlier, the site master plan has been developed and the thorough functional briefing process is close to conclusion. The master planning process included looking at the site from a future growth perspective so that there are opportunities not just for the site to accommodate other buildings or other structures well into the future, but also how the hospital building itself can potentially grow into the future. And we'll continue to work on that through the next stages of the design process too, to look at and test how that building can grow into the future. As I mentioned, the thorough functional briefing process is close to conclusion. That functional brief that's produced during this phase informs the design team on how the internal aspects of the hospital will function and interact. It includes some other important features as well, such as hours of service for some of the departments, access to the front of the hospital or the loading dock, and interaction with specific departments such as imaging. It's been quite an exhaustive process. We have consulted far and wide through the local health district, through both the existing hospitals and other stakeholders that are involved in the project too, including HealthShare and New South Wales Pathology. Some of the details of the size of that consultation is that it included 17 separate project user groups and included consultation with 160 clinicians from across those stakeholder groups. The next step in the design process is the production of a schematic design. This design will identify the size and makeup of each department within the new hospital. Those schematic design user groups are scheduled to commence next week. And as the planning phase of the project carries on, we'll continue to work through the complex project and scope definition period that includes determining the level of service to be provided by this hospital. And at each step throughout that process, throughout that hospital planning process, it's undertaken in close consultation with the local health district and those other key stakeholders throughout each step of the design timeline. Moving on to the project timeline, you can see there that we have achieved quite a lot since the clinical services plan was approved last year. The additional funding was announced in June of 2020 and the preferred site location was announced in southeast Maruya. In February, the master planning of the new site and the consultation around that master planning was commenced, and in May of 2021, that master plan process concluded, although, as I said, it will continue to be tested throughout the design of the project. During July, we had the great opportunity to undertake some significant Indigenous consultation with the local Aboriginal community. We held a walk on country and a design jam workshop to look at incorporating cultural aspects of design into the new hospital. I believe there was a question raised earlier by Fitzroy too. I hope to answer that here, Fitzroy. If I haven't, please elaborate further. But the project is participating in an exciting new pilot program developed by the New South Wales Government Architect or the Government Architect's Office. It's called Connecting with Country. The premise of the program is to approach the design of public infrastructure in a more culturally inclusive way that can incorporate cultural practices in the design of the facility. As mentioned, the project team held a walk on country with Aboriginal representatives and a design jam workshop that looked at potential cultural design solutions for the project. The project team will continue to consult with the Aboriginal community throughout the remaining design stages of the project, and we are excited to be a part of this unique experience. Some examples of cultural practices that we are looking to incorporate into the design of the project include birthing on country, and that is to have a maternity ward that is at ground level to give an opportunity to ground babies when they are first born. Some of the next steps of the project include the completion of the planning phase that includes the submission of a business case to New South Wales Government and the preparation of the complex planning application, which will be compiled throughout the latter half of 2021 and early 2022. The start of that planning process is the initial application for planning advice through the Department of Planning, Industry and Environment. That will be issued in the coming weeks, and there'll be some further communication to the community from the project at that time as well. That planning approval process is a significant and complex undertaking. As I mentioned, it will take a while to produce, up to 12 months potentially, and further consultation with staff and community will be undertaken during that time. There's a lot of supporting information, reporting, documentation that does need to be produced for that planning application, and that typically includes environmental assessment, cultural heritage investigations, biodiversity assessments, and climate and social impact understandings, to name just a few parts of that planning application. As mentioned earlier, the schematic design process is on track, and we've got user groups scheduled for next week to look at the departmental designs that are going to be worked through for each of those departments in the new building. And construction commencement remains on track to start in 2022. With the procurement of contractors for the project, that will come opportunities for local employment as well through the various trades that are required to construct a new hospital. We'll look to talk more to the community about those opportunities when they come up during that procurement phase. But it is an important aspect of that construction work that there with that comes significant opportunities for local employment. So that's my part for tonight. Thank you all for your time. I'll pass back to the team to facilitate the Q&A part of this evening's update.
Thank you. Now going to hand over to Vanessa, who's going to help us with the questions to our panellists this evening.
Thanks, Renata. We're just doing a little technical adjustment. So, hang on one second.
That's okay, Vanessa. I can jump in there for you. Megan, I have a question for you from Fitzroy. Are there any ventilators units currently located at a facility within the Eurobodalla? And if not, where are the nearest units to be found?
Sure, great question, Fitzroy. The facilities do, so both Bateman's Bay and Maria do have ventilator units for short-term respiratory support. So we're pretty well equipped in that regard. If people need longer-term ventilation, we would be moving people to Bega. Beds available, and if a patient is very, very unwell, we would go directly into a metropolitan tertiary centre. Thanks, Becky.
Thank you, Megan. We've also had an anonymous attendee write in regarding maternity and paediatrics. So I'll just read that out just in case that wasn't completely clarified for them. They've written, I have an 11-month-old baby and I'm very concerned that in the event that he gets sick or any other babies, then we have to travel a long way to get to a paediatrics ward. Will there be paediatricians at the new hospital who are based here, or will they fly in and out? What's the plan?
Thank you. I'll just respond anonymously back. So it's Megan speaking. So there will be a paediatric unit, as you've heard. As part of the workforce planning, we will be working towards a paediatrician in the Eurobodalla region. So that body of work will happen with our models of care and the workforce planning that we're currently working through in the project. But that certainly is the longer term plan. But we will use, so Dr. Susie Piper that works with Dr. Michael Holland is our paediatric clinical lead. She works in Illawarra, Shoalhaven, and we have some paediatricians in Bega that will be able to provide support to our GP VMOs. I think we've got to recognise that they have specialist skills, but if we need a specialist paediatrician, they can support our kids when they're admitted. Thanks, Becky.
Thanks, Megan. We've also had one last question come in. I'll direct it again to Megan, but it may not be one that we can answer at this stage. Will there be capacity to treat orthopaedic and plastics injuries at the new hospital without the need to travel to Canberra for treatment? From Farm Girl.
Hi, Farm Girl. That's a great question. So we can currently provide orthopaedic care here at Maria. Now it's minor orthopedic stuff. So any orthopedic trauma needs to go to a higher level of care. That's just how the levels of service are provided. So currently a lot of our orthopedic fractures and things will go to Bega, and some will go over to Canberra if we need very specialised support. But the plan is that we will be doing orthopedic surgery. There's planning underway. That may not happen day one, but we're working toward that with our perioperative planning. And plastic surgery, again, no immediate plans for that, but certainly will be considered as we move forward. Thanks, Becky.
Thank you, Megan. We have no other questions that have been sent through at this stage. I encourage everyone online, if you've got a question, feel free to just type it in the little Q&A box, and our resume panelists will be here to answer it.
Whilst that's everyone's putting in their questions, just to thank everybody online tonight, and also to our panelists thus far, and thank you for your responses. There's a team of people that all contribute to the redevelopment work and the planning that as it's been outlined, and thank you to all of those. They know who they are. We'll just give it another moment. No questions seem to be coming up. Oh, yep, we've had one pop up.
So from an anonymous attendee, Matt, this one will be ready for you, I think. So I know that the commencement is meant to be early 2022, but when do you think that the new hospital will be ready to open?
Thanks, Becky. So this is a good question. We are planning to start construction in 2022. This type of facility, for this size of facility, we'd be looking at about a 2-year build. So we're looking to a time late in 2024. We still need to put some effort in to confirm that though, and we're expecting to finalise the long-term planning for the completion of the hospital by the end of the year. But we're expecting at this point in time, late 2024, early 2025, but to be firmed up. Thanks, Becky.
Thank you, Matt.
Okay, I think that may bring us. Oh no, we've got another question. Fantastic.
One more come through. I'll put this to. This will be a Megan and Marg question. Will an MRI diagnostic facility be available? From Phil.
From Phil. Hey, Phil. I'll pick up, and Marg, please jump in. So in terms of the CSP, there were no provisions for an MRI in the new building. We're working closely with Health Infrastructure and the Ministry of Health around finding solutions around that. And I think what we've got to honour is the communities. There is an MRI scanner available to the community, and sometimes those partnerships are important. Thanks.
Thank you, Megan. We've had a question come through from Diana Williams. What policy influence on service delivery is expected to come out of the New South Wales Parliamentary Inquiry into health services in rural, regional and remote New South Wales?
Becky, could you just repeat that for me?
Yep,
if that's my question, sorry.
What policy influence on service delivery is expected to come out of the New South Wales Parliamentary Inquiry into health services in rural, regional and remote New South Wales? Just Diana Williams has asked this.
Sure. So when the inquiry is released, all of those things get considered, and Matt, you can probably answer this, and Marg, so do jump in. My understanding is from the inquiries, when there are recommendations made, adjustments then will be considered in line with any project that's happening. And certainly from an operational manager position, those inquiries under Margaret's leadership in Southern, we look at our models of care and the ways that we do our work to improve them when there's learning to be had.
I'd agree with that, Megan. Certainly, we'd need to see the outcomes to incorporate the changes when they come about. But it's happens often that we do have to change tack during projects to incorporate changes as they come about as policy changes.
Thank you both.
Okay, that may be the last of our questions, Becky, do you think?
I think so, unless we've got any last minute
Yeah.
ones madly. Oh,
there's
yes, we've
another
got
one. Fantastic.
John and Yvonne. Okay, so this is a question for Marg and Megan. What medical services will be provided in Bateman's Bay?
Are we talking about inpatient services? That's where we'll go from. So medical services is pretty broad. So as we know, we've got medical services in communities that are provided through our GPs and other service providers. There'll be general medicine. There's certainly we're doing some work around chronic pain management, endocrinology. So that's all of our diabetes. We're certainly looking at geriatric medicine. There's quite an extensive list in medicine in terms of services that will be provided. So we continue with what we've got. And we'll be certainly looking at things from the health needs. If you can be a little bit more specific, I can probably answer that question for you, but it is a pretty big thing. Or Marg, you might be able to jump in there.
So thanks, Megan. I think the other thing I'd say there is that the planning around the development of a Health One gives us an opportunity to consider into a fabulous new space, even what visiting services could we get. I think that's an important thing. And the other thing that would be very much part of the Health One development would be a virtual care space, which would mean that people who may have specialists in Sydney and elsewhere, for example, and would like to be supported to actually access those services in a virtual space would be supported to do so. And having recently had the opportunity to do that myself, I can say what a wonderful support that is when you save the travel. Thanks, Megan.
Thank you, Marg and Megan. We've just had another one come through from Esther. Will the hospital have a palliative care unit? Megan, that one's for you.
Sure. I'll answer that. It won't have a dedicated palliative care unit, but the way the units or the inpatient units are designed, there's quite a mix of single rooms that we would support end of life care in. And I think what we need to really hold on to as a community is most people prefer to die at home. So some of the work will be around how we support families and people at end of life to be able to pass away at home where it's safe and appropriate for that to occur. So that's probably the best way to respond to that one, Becky. Thank you.
Thanks, Megan. I've got another one for you from Diana Williams. What patient transport planning is underway? It's a fair distance from Bateman's Bay, etc., to Maria in critical circumstances. Oh, sorry, is it a fair distance?
Okay, so in terms of patient transport, so where you've got a critically ill person, so like you would do now, would be to call 000 and the ambulance will respond and take you to the right place to receive the care in the most appropriate time frame. Our patient transport services currently provide support between Bateman's Bay and Maria. But in terms of New South Wales Health per se, doesn't play a primary role in community transport, but we do have very, very strong partnerships with our councils and community transport providers to support people to access care when it's appropriate. But when you're really crook, 000 is your best friend, and we would encourage everyone to be using that.
Thanks, Megan. We've had another one come in from Phil for you, Megan. Will Bateman's Bay still have an ED facility?
No, so Bateman's Bay, so with the Health One, the planning's yet to start there, but as we decommission the current hospital, the whole of the hospital is closed down, and through the planning with the new Health One, we'll be able, there won't be emergency services there. It's a community health hub. But the planning will define what the service models are in that. I don't know whether you want to add to that, Marg, at all from a Health One, but I think I've got that one.
No, that's exactly so. Thanks, Megan.
Thank you both. We've had no other questions come through, so Renata, I'll hand back to you. Thank you, everyone.
Thank you, Becky. Look, thank you to all of our attendees online tonight. We really appreciate your interest. And thank you to our panel. Thank you to Matthew, to Megan and to Margaret. Also, thank you to our other co-facilitator, Vanessa, and those that have made components of tonight happen. We will be in touch with all attendees early next week to share follow-up information and a link to our new website, which is exciting. If you have any questions or you want to contact us about any matter, please do. The best email, and I'll read this slowly, is H, I, Eurobodalla Hospital @health.nsw.gov.au. We look forward to meeting with you regularly, and we hope that in the future it'll be in person. Thank you and good night.